I'm a huge fan of this concept of practicing at the top of your scope. What does that look like for you?
I think the most satisfying day in recent memory that I can think of is, helping a patient intubated on decently high vent settings, walk in the ICU, and then going directly down to the ED to evaluate a patient with acute undifferentiated dizziness, and perform an epi maneuver and have them be able to go on their way. It's not just the physical treatment of PT that's exciting, but leading kind of the team-based diagnostic approach as well, just going from one exciting domain right to the other, like literally back to back. That was such a satisfying day for me. And there's a lot of things in between,
Yes.
but in the hospital setting, to me, those are kind of the two big focuses on my end.
And like, what a privilege to be able to intervene with both of those different situations and both of those moments in people's lives. One thing I say a lot is the physical therapist can be the right provider at the right time. And it sounds like that's exactly what you were that day.
Yeah, always, healthcare is complicated. It doesn't always work out that way. Sometimes you have a day where you run around insanely busy and feel like you didn't make nearly the impact that you wanted to. And other times things just kind of come together. And the more we can chip away at the systems that we're part of to help maximize those opportunities, then the more satisfied we're going to be, because the better we're going to be helping our patients.
Yeah, and I think some PTs listening are probably like, John, I'm like way too burned out for that. There's no way. Nobody listens to me. Nobody even knows what I do. Like, how am I supposed to lead this culture change?
Hey, totally valid. I always say we're all active participants, whether we want to be or not, in the culture of the units we're on and the
Yes.
systems that we're part of. So I think, leading by example, cliche as it sounds, is an important thing to do. And I think also, um, setting processes so the team can reflect and see the rewarding things that they're doing. I think as busy and as stretched as we all are, it is possible to come back and feel really satisfied at what we're doing and to just take small improvements in increments from there.
I think too, when we're really practicing at the top of our scope, we feel like we have control over what's happening, right? Like we feel like we have control over our patient outcomes. We have control over how we're managing our patients. We're well respected in our departments and in our units, and people can see the value that we're providing.
Yeah, without a doubt. I mean, autonomy, we know from literature, is really highly associated with vocational satisfaction.
Yes.
And we're really extensively trained specialists. PT's in this funny spot where the utilization in a kind of older culture can be very different than the most current things that we know how to do. And um, yeah, there's lots of room to gain ground there.